I see a lot of patients with total hip or total knee replacements, and one question I often get asked is how to effectively reduce the swelling, and especially when I recommend elevating your leg overnight. Swelling is often increased in the evening as the force of gravity will force it lower down during the day with a lot of walking around. So elevating the leg overnight is a really good way of reducing the swelling, so your leg is a lot less swollen in the morning. This, along with sort of massage over total hip and total knee replacement scars, is really essential during the first few weeks. If your leg is swollen and you raise it higher than your heart, then the force of gravity will naturally move the fluid down, and this of course is very effective overnight. And if already swollen, the position shown in the video helps fluid from pooling in the lower legs. As shown in the video, just use 2 or 3 pillows really, and adjust it as needed really. So the 2 pillows should be lower down near your ankle, so your leg can be effectively elevated, and you can either lie on your back or on the side as shown also in the video. One question I often get asked is, what do you do if you're a restless sleeper and you move around a lot? There's not really an effective answer for this, but just try and, if you get your leg as comfortable as possible, then often you'll get a better night's sleep anyway and be less restless. But the benefits of this are very effective after lower limb operations when your leg will naturally swell in the first few weeks.